Hey guys, in this video I'm going to talk about what's actually happening within the brain when we get a concussion. I think it's important to have a basic understanding of what's happening to appreciate the importance of getting that appropriate care post-concussion, as well as to help alleviate some of the anxiety around it. I think the most important thing to note with this particular video is that we're not dealing with any structural damage to the brain, dealing purely with a temporary disturbance in the actual functioning of the brain that will resolve with time and appropriate management. So to go back to the start, when we get a concussion, obviously a couple of blows to the head causes the head to accelerate and decelerate really quickly, which causes the brain to jiggle around within the skull, kind of like jello. Used to think it was the outer layer of the brain banging against the inside of the skull that would create issues with concussion. There might be a little bit of that, but they've started to realize it's a bit more of a deeper disturbance to the brain caused by actual stretching of the brain tissue as it jiggles around within the skull. So you can see here we have a brain cell or a neuron. These essentially make up the structure of the brain. They essentially communicate with other brain cells by becoming activated and excited and producing this electrical signal to the next cell. So you can see here, essentially have these little molecules on the outside of the cell, molecules on the inside, and when a cell becomes activated, it produces this, it opens up these channels within the cell wall, which causes molecules to come in and out and causes the cell to become activated and produce this electrical signal to the next cell. When we get concussed though, and that brain tissue stretches, the brain cell also stretches and causes the channels to open up and close really quickly, forces those molecules to come in and out and causes the cell to become activated and produce that electrical signal. And that's essentially occurring across millions of neurons or brain cells all at the same time, and it creates kind of like this electrical storm within the brain, and that's essentially what we're observing when the person loses consciousness or is disorientated and things like that. Now, when that big electrical storm happens, it uses up a lot of energy within the brain, and we actually go into this energy deficit over about a 22 to 30 day period, so about a month, and this is called the vulnerability period. It's essentially when we're most vulnerable to a second concussion. So you can see a little graph here. I've got energy on the side and then time down the bottom. We get that electrical storm, and then we go into this energy deficit or vulnerability period after. You can see sort of bottoms out probably around that 3 to 5 day mark. Most people's symptoms are gone by that 7 to 10 day mark, but you can see even if the symptoms are gone at that point, we're still in an energy deficit, and the brain is still therefore recovering, and therefore we're still vulnerable. So if someone was to get another concussion, say at that point where the energy levels are still low, even if their symptoms are gone, those energy levels drop even more, and that vulnerability period is drastically increased. So we're talking like 3 to 4 months now. The symptoms are much worse and are lasting much longer, and the energy levels actually drop below a certain point where there's actual brain cell death and irreversible brain damage, similar to what you actually observe in a severe traumatic brain injury, even if those two separate concussions are quite modest. So there's a definite risk going back too early into an environment where a concussion is a potential risk. On the flip side to that, if we were to get concussion outside of that 30-day period, our symptoms are gone, our energy levels are back to normal. It's just like getting a singular concussion, so there's no additive effect and no real risk of any brain cell death or anything like that. So I guess the important thing to note is it's not necessarily how many concussions you get in a lifetime, it's kind of like how close they are together. That is more of a concern, and why we need to be quite diligent and cautious with our management approach and returning to sport or an environment where that concussion can potentially occur again. Now, Fortunately, for some people, particularly those that don't get that appropriate care post-concussion, actually develop symptoms that last beyond that 30-day period. So even if they don't get another concussion, and that's called post-concussion syndrome, or PCS. The main goal with these particular cases is trying to figure out why that's happening. And there's a range of reasons why it may occur down here, which I'll go through right now. So the first one is blood flow. So when we get concussed, we get impaired blood flow to the brain. This creates symptoms that are increased when we place strain on the cardiovascular system. So things like exercise might be enough to set someone's symptoms off. We test for that within the clinic, so we do specific exercise testing on the treadmill or the exercise bike, which will help us determine what intensity of exercise is actually provoking the symptoms, which can provide guidance on what exercise, type of exercise and intensity of exercise we should be prescribing to help resolve those symptoms. Next one's metabolic. This refers to the energy levels we discussed before remaining low, which then produce symptoms. This isn't a very common way to have experience lingering symptoms, particularly because it's caused by people not having that an adequate reduction in activity post-concussion, which most people have anyway. But if someone was in that small percentage of people that haven't had adequate rest, then we may consider prescribing a short rest period to try and get on top of those energy levels. Next one, inflammation. So when we get a concussion, there's inflammation within the brain, and that's a normal thing to happen. We need it to happen for the brain to recover, but unfortunately, in some cases, it can turn into a more persistent or chronic inflammatory cycle where that the inflammation creates more inflammation, which creates more inflammation, and so on. So we tackle this with specific dietary changes and supplementation, which are research-backed and evidence-based, to try and get on top of that inflammation and try and break that persistent inflammatory cycle. We also have visual and vestibular. So a range of visual vestibular issues can occur following concussion, resulting in things like blurred vision and dizziness and loss of balance and things like that. They might be pre-existing issues that are heightened following the concussion or produced by the concussion itself. We do specific testing called VOMS testing, which helps identify more specifically what might be occurring, and also helps us prescribe the right exercise rehab for that person to try and get on top of those issues that might be related to those two particular systems. The next one we have is neck. So to get a concussion, we need like 70 to 120 G of force, but to get a whiplash, we only need 4.5 G of force. So if you're getting a concussion, you're almost definitely getting some level of whiplash as well. And whiplash can present pretty much identical to a concussion as well. So headaches, nausea, dizziness, things like that. And that whiplash can traditionally last a lot longer than that 30-day period. So it might be a reason why those symptoms are lingering around a lot longer. Again, we assess for this and provide appropriate treatment to try and get on top of those neck issues and try and resolve those neck-related symptoms. Last one is psychological. So there's obviously a range of psychological factors that can come about following a concussion, things like anxiety and depression and fear. These are not uncommon and can actually promote and enhance a lot of symptoms in some cases. So a lot of a big part of management is trying to sit down and discuss with people what their individual concerns and anxieties are around the concussion, and providing the right education and advice to try and alleviate some of those anxieties, as well as identifying any unhelpful beliefs or behaviours that might actually be negatively impacting someone's recovery as well. So that's a pretty broad overview of what's actually happening with the concussion and what might be contributing to someone's more persistent symptoms. I hope that gives a more clearer picture to the factors involved. But if you have any questions on it, or you're unsure on anything, feel free to reach out, and we'll be happy to have a chat about it.